Okay, let us, guys, continue the second part of the lecture. It was about the heart. So we described the surfaces and the borders of the heart, and now we have to talk about the chambers of the heart. You know that the heart divided by vertical septa. There is a septum between two atria and another septum between two ventricles. So these vertical septa divide the heart into four chambers. There is right atrium here and left atrium here, posterior to it, of course. And there is a right ventricle here, and posterior to it there is a left ventricle, of course, posteriorly as well. So four chambers, and the right atrium and right ventricle are anterior to the left atrium and left ventricle, respectively. So, as I mentioned before, the heart's not like that. Right, left, right, left. No. The heart, like in this position. So, the right atrium anterior to the left atrium. The left atrium is posterior. It forms the greater part of the base of the heart that's located posteriorly against the esophagus, if you remember, which is important. And similarly, the right ventricle is anterior to the left ventricle. So let us start with the first chamber, which is known as right atrium. This is the right atrium, in which, you know, it's opened in this case, and there is a ridge here. But before talking about this ridge, let us look to the right atrium from the back. So this is the superior vena cava, yes, and this is the inferior vena cava, and to the right of superior vena cava and inferior vena cava, there is a kind of a sulcus here. Look at it. There is a sulcus here. This sulcus, guys, known as sulcus terminalis, in which if you open the right atrium, like inferiorly, in the inferior figure, this sulcus terminalis marks the crista terminalis internally. That means this ridge, that known as crista terminalis, is the sulcus terminalis from outside. So this ridge, I would say, divides the right atrium into two spaces. Not separate them actually, no. Just we can say there is a space behind this ridge and the space anterior to this ridge. The space of the right atrium that's located anterior to the crista terminalis is rough and has this shape. Rough because of the existence of a kind of muscle fibers known as musculi pectinati, or the pectinate muscle, right? Is a pectinate muscle. Creates kind of rough, irregular ridge. And on the other hand, the space of the right atrium that's located behind this crista terminalis is like smooth and has a couple of like openings, like opening for coronary sinus, and this fossa. We'll talk about it. So this is what I mentioned, right? So this space that's posterior to the crista terminalis, which is indeed, we consider it as a sinus for vena cava. Like this is the inferior vena cava and this is the superior vena cava. So this is the sinus, يعني الجيب تبع السوبيريور vena cava والinferior vena cava. When the blood comes and reach the right atrium, usually it reaches this space that's known as a sinus of vena cava, which is smooth and has a thin wall compared to the rough and thick wall of right auricle. This is an auricle, which is the atrium proper. So then once the blood reaches the right atrium, it will move to the right ventricle through a valve, atrioventricular valve. This is the right atrioventricular valve, or known as tricuspid valve. Tricuspid valve. We'll talk about it. Okay, so this is from fixed heart. Don't be confused, guys. If you look at this figure, you would see that they open the right atrium from this anteriorly and or say from the left side, then they reflected to the from left side and reflected to the right side. But in this heart, they open it from here and they reflected to the left side. So don't be confused. Still, we have pectinate muscle and we have the crista terminalis. That should be here at this level. So if you close it, you will see that the crista terminalis is here, right? Is here, which is as I mentioned, at the right to the side or right border of superior vena cava and inferior vena cava, as you saw it here, guys, right? Okay, so this is the superior vena cava, the opening of superior vena cava, and this is the opening of inferior vena cava. One thing I would like to mention that the superior vena cava pierces the heart at the level of the third, of course, third costal cartilage. But the inferior vena cava, which is larger than the superior vena cava, pierces the heart at the level of the right sixth costal cartilage. This is surface anatomy. You have to know that. Okay. So what we have here also. So the blood comes from superior and inferior vena cava. This is the opening of inferior vena cava to the right atrium. Then it moves to the right ventricle through the tricuspid valve. Okay. What else? What we have in the right atrium other than, we described many features in it, but still we have a lot in the right atrium. So this wall is the interatrial septum. Inter, that means in between. Atrial, between two atrium or two atria. Atrium is singular, atria is the plural. So this is the wall between the two atria, the right and the left. Okay, but there is an important landmark, which is like a fossa, like oval shape. Yes. So this fossa with the oval shape known as fossa ovalis. It was a foramen. كانت فتحة. It was a foramen and known as foramen oval because of the shape. The fossa oval was foramen oval in the imperial and fetal period. It's important in the fetal life. Why? Because the lungs of the fetus are non-functional before birth. So the blood, the oxygenated blood, I would use the red color. The oxygenated blood comes from the mother through the inferior vena cava. So this oxygenated blood should be distributed directly to the fetus. No need to send it to the right and left lung. Not because it's just oxygenated, but also because the lungs of the embryo are non-functional yet. So the blood comes to the right atrium through the inferior vena cava. Then it will move through this opening, this foramen, because this foramen was open, patent in the imperial fetus. So the blood moved from the right atrium to the left atrium here. So that means you have left atrium and you have right atrium anterior, and there is an opening in between. So the blood will go directly to the left atrium. So then from left atrium, as you know, to the left ventricle, then from left ventricle to the aorta and to the rest of the body of the fetus. Oxygenated, ready for use. But this is what happened. But imagine that wasn't happening. So what's the other scenario? Somebody can say, okay, forget that this of fossa ovals or the foramen oval exists. If it's not exist, say it's not exist. It exists indeed. But the oxygen will come to the inferior vena cava, the right atrium, then right ventricle, then from right ventricle to the pulmonary trunk, then from pulmonary trunk to the lungs. But wait, the lungs of the fetus are non-functional. So why? Will not be oxygenated. So that means no need for this path. So the blood comes directly from right atrium to the left atrium, then to the left ventricle, from left ventricle to the aorta to the rest of the fetus body. So this foramen closed immediately after birth, and after the pulmonary circulation starts. So it will close gradually after birth, and no need for it. So yes, this is some time to not close. So this is we'll talk about it in the next, I would say, after 2 or 3 weeks, about congenital abnormality. So the last thing about the right atrium, let me summarize it to you guys. What's the opening openings in the right atrium? We have the opening for superior vena cava, and inferiorly the inferior vena cava, and superior to the opening of inferior vena cava there is the fossa ovalis. We mentioned that. So it's superior to the opening of inferior vena cava. And there is another opening for the coronary sinus, and we mentioned that the coronary sinus is a large vein posteriorly. It drains the blood from the most of the heart itself. Drain the blood from the heart itself to the right atrium. It's located just anterior, sorry, just medial to the inferior vena cava, just medial to the opening of inferior vena cava. So we have fossa ovalis superior to it and opening of coronary sinus medial to the opening of inferior vena cava. So there is also this opening which is known as right atrioventricular uh, orifice. This is the atrioventricular orifice that's guarded by a fibrous ring. This fibrous ring, is known as just to know, known as tendon of Todaro, tendon of Todaro. So it gives the attachment to the tricuspid valve. So the tricuspid valve attached to it. So also, just to know that the some, which is like tiny blood can um, return back to the right atrium itself by a small veins in its wall. That's it for the right atrium. Now let us move from this cavity to the right ventricle. So already the blood will move from the right atrium to the right ventricle. Let us go to the right ventricle. Okay, here's the right ventricle. So first of all, the right ventricle communicates with the right atrium through the atrioventricular orifice. And there is a valve here known as tricuspid valve. Tricuspid valve. We will know why it's a tri, that means it's three, and cusp. Okay. So it communicates with the right atrium and it also communicates with the pulmonary trunk through this orifice, pulmonary orifice. يعني هون لما بنقول orifice يعني زي المدخل، بداية المدخل. اوكي؟ انا ما بحكي عن الفالفات. لما تقول orifice يعني المدخل، البوابة، قريب البوابة. هاي this is orifice. So as look at the heart here, it looks like inverted cone shape. يعني زي المحجان المقلوب، مخروط المقلوب. مش نعرف المخروط هو هيك؟ لا، هو هون جاي معكوس. It's inverted cone shape, like funnel shape. And this part of this funnel that's closed once you approximate the pulmonary trunk, this area known as the infundibulum يعني المدخل or conus arteriosus. Conus arteriosus from cone shape مخروط الشكل. Conus arteriosus, which is smooth area. Okay, so here the blood comes from the superior vena cava, inferior vena cava to the right atrium. Then from right atrium, it moves to the right ventricle through the tricuspid valve. Then the blood moved or pumped from the right ventricle to the right and left lung through the pulmonary valve and pulmonary trunk. Or I would say from the right ventricle to the pulmonary trunk that's guarded by pulmonary valve, another valve. So the blood, the deoxygenated blood goes to the right or left and right lung to be oxygenated. Then once it's oxygenated, it returns back through pulmonary veins to the left side of the heart, to the left atrium, either from here or from here, to the left atrium. Okay, this is another story, but so again, this is the right ventricle, in which the anterior wall of the ventricle reflected here, and you will see that the later you will know that the wall of the right ventricle is thinner than the wall of the left ventricle. However, this is the right atrium, and so the blood moved from the right atrium to the right ventricle. That and there is an orifice, atrioventricular orifice, that guarded by tricuspid valve. Look to the wall of the right ventricle. So this muscle creates a kind of trabecular kearney. Let me show you. So again, oh yeah, we have the same figure here. Okay, so this irregular muscular projection known as trabecular kearney in the ventricle, and some, attached from both sides, creating also a kind of a bridge, right? Like this uh, part, this muscle fiber, which is known as moderator band or septomarginal trabecula. It's important. This part, this moderator band, this part, this band is important. We'll talk about it. So, this trabecular kearney or muscle fiber can be connected from both sides, creating like a kind of a bridge, زي الجسر يعني, to carry like nerve fibers, specialized nerve fibers in it. So this part, indeed, let me show you. This moderator band, known as also septomarginal trabecula, because this trabecula connected to the septum here, interventricular septum, and to the margin of the papillary muscle, to the base of the papillary muscle. So that means there is something also called papillary muscles. Yes, here we go, which is like nibble shape. So what these muscles? Okay, these papillary muscles also, they are trabecular kearney, but they are attached from one side, but the other side is free, like this tip. So they have a nibble shape زي شكل الحلمات. So we have anterior groove or anterior papillary muscle, and we have also posterior papillary muscle, and also we have septal papillary muscles. So septal because attached to the interventricular septum. So they named anterior, posterior, septal according to their position in the ventricle. But at the end of the day, papillary muscles or moderator band, all of these are trabecular kearney, irregular muscles, right? Or muscular projections in the in the wall of the ventricle. Okay, so look at the papillary muscle. They give an attachment to the tricuspid valve through a kind of tendinous threads زي حبال وترية يعني. They give attachment to the tricuspid valve through tendinous threads. Look at the septal one and also look to the posterior one. They have very important function. We'll talk about it. So, as I mentioned, there is a single specialized trabeculum known as septomarginal trabecula or moderator band form like a bridge تعمل جسر between the lower border of the interventricular septum. This is the lower border of interventricular septum between two ventricles, and the base of papillary muscles. So it carries, look at the fibers. There's a kind of uh, cardiac conduction system, nerve fibers like that passes through it to the wall of the right ventricle, because you know this, the atrioventricular bundle divided into two bundles, left bundle and right bundle. So the right bundle should reach the wall of right ventricle. So we need a bridge. بالنجسر يعني. But the bridge was the moderator band. Okay, so it's important, isn't it? Again, here's another view. You'll see that, okay, the fibers, the cardiac conduction system, the right bundle, I would say, passes through it. So, guys, between the right atrium and right ventricle, there is right atrioventricular valve, that known as tricuspid valve. Because on the left side here there is bicuspid valve. Anyway, leave it for now. So the tricuspid valve, which is, if you look to the its atrial surface. What do I mean by atrial surface? That means the part of this valve here is like smooth. If you look at it, it's smooth, right? But its ventricular end or surface has a kind of tendinous threads known as chorda tendini that's attached to the tips of the papillary muscles in the right ventricle. So furthermore, the base, as I mentioned before, a couple of slides, the base of the tricuspid valve is secured and surrounded by a fibrous ring that's known as tendon of Todaro. So this tendon gives the attachment for the tricuspid valve and supports the atrioventricular orifice itself. So it maintains the shape of this opening. So the opening of right atrial, the opening of, or what we call the atrioventricular orifice, is like enough to, I would say it's about 1 inch wide, which is enough to admit the tips of 3 fingers, right? So furthermore, guys, I would show you this also. Look, we have 3 cusps. This is, of course, anterior, and this is posterior, and this is medial occipital. So this is the anterior cusp, and this is the posterior cusp, and this is the septal cusp. Now, if you look at here, it's known as septal cusp, right? Why? Because it's close to the septum here, interatrial septum. So what we have in the right side of the heart, other than the tricuspid valve, you know that the blood comes from the right atrium to the right ventricle through the tricuspid valve, and from the right ventricle will be pumped to the pulmonary trunk through pulmonary valve. There is one thing from the beginning, guys, you have to know, which is the Listen, we have a tricuspid valve and bicuspid valve. Both are between the atria and ventricles. So they are known as atrioventricular atrioventricular valves. But we have pulmonary valve and aortic valve. Those two valves known as semilunar valves. So we have atrioventricular valves like tricuspid valve and bicuspid valve on the left side, and we have semilunar valves, which they are including the pulmonary and aortic valves. So let us start with the pulmonary valve. So it's also, when you look at it here, this is the pulmonary valve. Also, it's guarded by a fibrous ring as well, which is part from the heart skeleton, and it has a kind of uh, uh, it has like three cusps around in two anterior and one cusp posterior, because this is the anterior surface of the heart, and of course posterior to these two cusps there's another one, which is the posterior one. But let me show you this. Yes, we know that this valve composed from three semilunar cusps. What do you mean by semilunar? Like cups, like this. It's not complete, right? So two around anterior and one around positioned posterior. But when you come to we accept that, yes, there are two anterior and one posterior, but the name of these cusps is like confusing. Why? Because the name of these cusps, the names come from the embryonic position before the rotation of the heart. Why? We don't know, but the name of these cusps comes from the embryonic heart. Comes from their position in the embryonic heart before the rotation of the heart. What does it mean? Okay, I will show you. For example, these two cusps. This one is anterior semilunar cusp, and this is right. On the other hand, this is left. Why? Why this is right and why this is left? Okay, this is anterior. Maybe I can accept that, but this is right and this is left. I will show you. After I will say, okay, after this slide, we will explain the name of those cusps. So just because we mentioned that they are semilunar cusps, يعني نص هلالي زي نص الهلال, right? So in the middle, there is a kind of a thickening portion known as nodule, and there is a thin lateral portion known as lunule. So we have nodule and lunule. So when the right ventricle pumps when the right ventricle pumps the blood up, so the blood pushes the cusp, so the blood will go from the right ventricle to the pulmonary trunk. But when the blood tries to return back to the right ventricle, automatically will fill these cusps. So when these cusps filled, they will create a kind of a blockage or a valve known as the pulmonary valve. Now, as I mentioned, the basis for naming the uh, cusps of the aortic and pulmonary uh, valves comes from the their arrangement in the embryonic heart, so not to their postnatal anatomical position. What does it mean? Okay, so during the embryonic period, there is a big vessel known as truncus arteriosus. This truncus arteriosus is the arterial trunk for both ventricles, right and left, in the embryonic heart, I mean. And when you take a cross section to it, you would see that it's composed from 4 cusps. With further development, this truncus arteriosus will be divided into 2 vessels. So it divides like this way. So still, sorry, before that, if you look to the cusps, I forgot to mention that, it has 4 anterior, posterior, right and left cusps normally. After division, the posterior will stay posterior, the anterior will stay anterior, but the right and left, will be divided. So you will find part from the left here, part from the left with pulmonary valve, and another one with aortic valve. The same with the right cusp. Part of it or half of it will go to with the aortic valve, and part of it with the pulmonary valve. So you will see that, okay, we have 2 vessels with its own valves, every one with 3 now cusps, right? For example, of course, there is a little bit of rotation for the heart during the development, so it becomes like this, and this is the pulmonary valve, and this is the aortic valve, because you know that the pulmonary valve is anterior to the aortic valve. Let me show you again here in this figure. Okay, I know you'll be confused, but I will let you know how it looks like. Okay, so this is, you are watching now you are watching the screen, right? You are watching the video. So this is your heart. This is your heart, but they removed the both atria. يعني شالوا الرايت والليفت اتريوم، شالوهم ورميناهم. هذا الهارت هو الهارت تبعك، زي ما انت هذا، يعني لو انت شلته من السكرين بس رجعه ترجيع حطه في الشست عندك، لانه هذا هون anterior من الامام. فهذا this is the pulmonary valve, and posterior to it the aortic valve. On on this side, of course, you have the tricuspid valve and mitral valve or bicuspid valve. So I would say we need to rotate it. We need to rotate it a little bit like this, also to make sure. Okay, so now let us bring this figure, control copy, and just go here, control V. Okay, so I know you now, you are confused because this is for the heart of somebody who's lying on his back. هذا الهارت لواحد نايم على ظهره. So what we have to do, we will rotate it here this way. So guys, this will be your heart, right? So now let me show you now. Okay, so this is the
pulmonary valve, and this is the aortic valve. This is the pulmonary valve, and this is the aortic valve. So this is the anterior cusp because it's anterior, and this is the right and left. Right and left. Okay, now let us move to the aortic valve. So this is the posterior cusp, and this is the posterior cusp. It's known as non-coronary semilunar cusp. Why? I will show you. This is the posterior, yes, and this is the right and this is the left cusp. So you have right and left and posterior. Here you have right and left and anterior, because you remember the division. They were one cusp in the truncus arteriosus. Anyway, Control Z, Control Z. Okay, look at the right. From the right, this is the sinus. This is the cusp, and this is the sinus of the cusp. So from here, there is an opening for one coronary artery, and from the left coronary, sinus, you will find the left coronary artery. So here's the right coronary artery. This is the right coronary artery, and this is the left coronary artery. So each one arises from the right cusp and left cusp. It's from right coronary from right coronary sinus and left coronary sinus, just a little bit above the cusp, with an opening. You know that the right coronary artery and left coronary artery, the main arteries that supply the heart itself. يعني القلب نفسه بيتغذى من هذول التو arteries. Okay, that's why maybe now you can understand why. Let me go back, guys, here and erase some of these things. Now I would say maybe you can understand why in the pulmonary valve you have two cusps, anterior and one posterior, but the name of them, why they named, for example, why this is anterior, we described why, and why this is right, we described why this is left, we described why. To understand that, just rotate the heart a little bit to this side, because the heart in the during the imperial development rotated this way. To understand these valves, just rotate the heart. Imagine that you rotate the heart to this way. So what will happen with these cusps, that this one will become here, and this because you rotate it here, and this will rotate it here. You are rotating the heart. So sorry. Okay, so this one will be really anterior, because now it looks like to the left, but now it will be anterior, and those will arrange beside each other like that. And this is the right, and this is the left. So it does make a sense? Yes. So let us now shift the same manner with the aortic valve. I will show you again. So here's just to remind you with the movement of the blood through the right side of the heart. So the deoxygenated blood comes to the from upper part of your body through the superior vena cava, and from inferior part of your body through the inferior vena cava. So then the blood reach the right atrium, from right atrium, pass through the tricuspid valve to the right ventricle. From right ventricle, it goes through the pulmonary trunk, of course, that guarded by the pulmonary valve, semilunar valve, right? Then pump to the right and left lungs. Then the blood oxygenated in both lungs, and the blood should return to the left side of the body. So the oxygenated blood from the right lung will return through right pulmonary veins, and from the left lung also through left pulmonary veins. Both will drain into the left atrium. هتقول لي هذول وين رايحات؟ البلمونري veins. They will return the blood here from the back, right, to the left atrium. From left atrium, the blood pass through the, not the tricuspid valve, no, it's through bicuspid valve on the left side. Or, you will not hear anybody, I would say, mention the bicuspid valve. No, they use mitral valve. It's known as mitral valve. And if I want to ask you in the exam, maybe I would use the mitral. So try all the time, use mitral. But you have to know that it's bicuspid valve. So, or it's known as left atrioventricular, because this is the right atrioventricular or tricuspid valve, and this is the left atrioventricular valve, known as bicuspid valve and also known as mitral valve. However, the blood moved from left atrium to the left ventricle, then from left ventricle will pump through the aorta, then to the rest of your body, either up and or down, or and down, not or, because should be bumped to the upper part of your body and lower part of your body. So upper part of your body through these three branches, to the lower part of your body and thorax, abdomen, pelvis, and lower limbs through the descending aorta here. Okay, it goes like this from behind the heart and down. So let us now shift to the left side of the body and start with the left atrium. While shifting now, guys, to the left side of the heart to talk about the left atrium. This is the left atrium. So, as you know, guys, from the previous 2 lectures or so, that the left atrium is located posteriorly, and it's located just anterior to the esophagus. And we mentioned that the left atrium forms the greater part of the base of the heart, because we mentioned that the base of the heart formed mainly by left atrium and part of right atrium. So let me erase these things. As you see that the wall of the left atrium mainly is smooth, except a small part with this muscular extension that known as left auricle. Also, the right atrium has right auricle, in which, form mainly or line mainly by musculi pectinati or pectinate muscle, creating a kind of rough ridge, as you see. So, furthermore, this is the interatrial septum between the left atrium and the right atrium on the other side. And we mentioned in the previous couple of slides that this interatrial septum has a kind of fossa with an oval shape known as fossa ovale. This one. That was foramen ovale. Anyway, we are looking now to the fossa ovale from the left atrium, from the side of the left atrium, from the other side. You can see also here is the valve of the this foramen. This foramen is like this from the right side and here from the left side. So when the blood in the fetus reaches the right atrium, so there's increase in the pressure of the right atrium. So the blood pushes this valve. So this red one will push like that, then push like open like that, just to get the idea, right? So the blood can get in to the left atrium. Then from left atrium, the blood will pump to the left ventricle. Then from left ventricle to the aorta and for the rest of your body. So now let us reverse the process. After birth, okay, let us return this, okay, the valve. Okay, so after birth, with the after starting the pulmonary circulation, the blood will pump into the right atrium, then right ventricle. Then from right ventricle to the pulmonary trunk and lungs. From lungs, the blood will return to the left atrium through pulmonary veins, two on the right and two on the left. So the blood or the pressure that's created by returned blood from the lungs will be higher than that on the right. So it will push this valve against the other flip. So it becomes like that. So there, I would say, there is an equal pressure on each side of the valve. So by the time after birth, it will close normally. This foramen ovale will close after birth and just becomes like a remnant. It's like a depression in the interatrial septum. So also you see here the valve, as I mentioned earlier, which is like a depression in the wall. Now, I think further we have we have four pulmonary veins, two from the right and two from the left, and there's these veins have no valves. The blood, once reached the left atrium, will move to the left ventricle through this orifice that known as left atrioventricular orifice, that guarded by this valve that known as mitral valve or bicuspid valve. Now let us shift and follow the path of the blood from the left atrium to the left ventricle. This is the ventricle, the left ventricle of the heart with the thick wall compared to the right one. So it receives the blood from the left atrium, as I mentioned, through this orifice that guarded by mitral valve. And look at it, we are looking to the left side of the heart. And this is the interventricular septum or wall between the left ventricle and right ventricle. So this ventricle, I would say, has two parts. This one rough muscular part, and this one is the membranous smooth part. Of course, it contains the trabecular kearney, and it has two large papillary muscles, the anterior papillary muscle and the posterior papillary muscle. Let me show you here. So here's the anterior papillary muscle, and this is the posterior papillary muscle. Mainly the anterior papillary muscle located just anteriorly and to the right, and the posterior papillary muscle located posteriorly and a little bit to the left. And I would say also that these papillary muscles attached to the chorda tendina of the mitral valve. So let us remove part of the left ventricle and have a look to the again internal structure of the left ventricle. Look at it. Here is the mitral valve, in which the blood comes from the left atrium through mitral valve to the left ventricle. Then it ascends in this smooth area that known as aortic vestibule. يعني vestibule يعني المدخل للأورطة. There is the aorta, and this is the aortic valve, and this is the aorta or ascending aorta. So the blood ascends in this way, as you see here in this figure, ascends up through the aortic valve. Now this is just to this is a cross section, transverse cross section through the heart to show the lumen of the right ventricle and left ventricle, and to have a look to compare between the thickness of the left ventricle. You know, it's thicker than the wall of the right ventricle. And this is, something related to the function of it, because the left ventricle has to push the blood, to pump the blood against the whole body. But the right ventricle has to push or to pump the blood just to the lungs. So again, the mitral valve or the left atrioventricular valve, located again between the left atrium and left ventricle. It's composed from two cusps. One is anterior and one is posterior. This is one anterior and this one is the posterior one, connected by chordae tendineae to the papillary muscle in the left ventricle. So it's also encircled or fixed up to a fibrous ring, left fibrous ring, which is, this left atrioventricular orifice. Of course, it's a little bit smaller than the right one, which is just enough to admit the tips of just two fingers. compared to the right atrioventricular orifice that's enough to admit the tips of 3 fingers. So this is the mitral valve, guys, and this is the anterior cusp, and this is the posterior cusp of the mitral valve. So the anterior cusp located to the right and anteriorly, but the posterior cusp located to the left and posteriorly. Let me explain more about that. We are looking to the heart from the left side. Just twist the heart in this way. Just twist it. Put it in an anatomical position. So this is the heart, anatomical position, and this is the anterior cusp, and this is the posterior cusp. So, because this is the anterior surface of the heart, so the anterior cusp located to the right, and this is the left, right, located to the right and a little bit anteriorly, because this is anterior surface of the heart. So to the right and a little bit anteriorly, but the posterior cusp located toward the left and a little bit, it's posteriorly and a little bit to the left, because this is anterior and this is posterior. This is right and this is left. So what else we have here? Nothing, I think. Let us shift to the aortic valve. So you know that this is the tricuspid valve and this is the bicuspid valve, or known as mitral valve, we said. And you know the pulmonary valve, and similar to it, we have an aortic valve. We talked about that earlier, especially the name and related to the embryonic position. So what I want to mention here in this valve, let me just twist it a little bit. This stuff, and okay. And I would like also to bring this. Where is that? Okay. So now, okay, here we go. Control V. So guys, again, this is the pulmonary valve and this is the aortic valve. So after rotation of the heart, you know that will be the anterior cusp right and left for pulmonary, and opposite to that we have the posterior cusp here, and this is the right cusp and left cusp. Forget these the names of these cusps. What I want to say that in the pulmonary valve, there were two cusps directed anterior and one posterior. But in aortic valve, of course, we have three semilunar cusps, and we have just one anterior and two posterior. But in the pulmonary, we have two anterior and one posterior. Anyway, this is just to remind you about what mentioned before. So look at the, I think we mentioned also that the right coronary artery, and this is the left coronary artery from the right and left coronary sinus respectively. But the posterior cusp of the aortic valve has no coronary vessels. That's why sometimes it's known as non-coronary semilunar cusp. Okay. Again, it's similar to the idea of pulmonary valve because both are semilunar valve or valves. So again, we have a thick middle nodule and thinner lateral lunule. But in the aortic valve, we have two openings, one for the right coronary artery and one for the left coronary artery, that those arteries supply the heart itself. This is a superior view after the both atria, the right and left atria, removed. So this is anteriorly, you see the pulmonary valve, posterior to it, the aortic valve with two coronary arteries, one on the right and another one on the left. And also you see the tricuspid valve, 1, 2, 3, and the bicuspid valve. Now, this is just again it's a coronal section for the heart showing the four valves, the atrioventricular valve and the semilunar valve, including pulmonary and aortic valve. So, and in this figure also, you can read the legends here written and follow the steps of the blood or deoxygenated blood. I don't like to say deoxygenated blood because in reality it's not deoxygenated 100%, but it's like oxygen poor blood or oxygen rich blood on the other side. So just follow the steps so you can understand the both circulations. Now, simply the heart has a cardiac, has a skeleton and a dense fibrous connective tissue that gives it the supports for the valve, and indeed electrically separating the atria that already removed from the ventricles. So the cardiac skeleton, as I mentioned, summarized in four, I would say, four fibrous connective tissue. We have right fibrous ring here around the tricuspid valve, and we have left fibrous ring around the mitral valve. And also, we have a fibrous ring for the pulmonary artery with a trigon here and also trigon here, and for the aortic valve and pulmonary valve. So it is again a superior view for the valves after removing the atria, and that was taken during the diastole of the heart. You know, the cardiac cycle has two events, diastole and systole. So this is during diastole, and you'll see here that the atrioventricular valves are open to let the blood drain from the atria to the ventricles. And here we have systole phase, in which the AV valves are closed and the semilunar valves, including the aortic and pulmonary valves, are closed, are open. So the blood will be ejected from the ventricles to the pulmonary trunk here and to the aorta here. We took just the bicuspid valve as an example, and you know, when the blood returned to the left atrium and the pressure of the left atrium is increased, so I would say 70 to 80% of the blood will pass passively without contraction of the atrium. However, the blood moves through the bicuspid valve, as you see here, and in this case, the ventricle and papillary muscles are relaxed, and the chordae tendineae also are slack and relaxed. So, in this case, the blood will move from the higher pressure from the atrium to the lower pressure, in this case the ventricle, the left ventricle I mean. Now, once the blood in the ventricle increased and the pressure, I would say, in the ventricle increased, the ventricle will contract, and when it contracts, the blood will slam shut the cusps, as you see here. Once the ventricle contracted, the blood will slam shut the valve and bring the two cusps against each other, and the valve will close, as you see here. Create this when the cusps come against each other, they will create a kind of a sound that's known, lop. There is two sounds created by closure of AV valve and semilunar valve. Those sounds like lop, dop, lop, dop, lop, dop. So in this case, we talk about the one of the AV valve, I mean the bicuspid valve. So when the cusps come against each other because of the blood, so they will create a kind of a sound like lop. So in this figure, guys, which is pretty easy if you follow the steps as you see. So in this case, the blood returned to the atria. Of course, talk about right or left, the same, but for example, they took the same, the left side of the heart. However, when the blood returned to the atrium and the pressure increased, so the valve will be forced to open. So the bicuspid valve or the mitral valve, as you see here, opened. So the blood moved passively. 80% or 70 or 80% of the blood will move passively without contraction. Then the atria will contract to push the additional blood to the ventricle, the 20%, I would say. Now, after that, when the ventricle, filled and when the ventricles contract, they will force the blood against the AV valve, right? You see how the blood slams shut the cups and bring the cups against each other. So bringing the cups against each other create a sound, as I mentioned, which is like lop. So lop sound, the first one is the closure of AV valve, created by closure of AV valve. Now, the ventricle, as I mentioned, when the ventricle contracted. So here at the early stage of the closure, here at the end stage of the closure of the ventricle, sorry, here is at the, sorry, okay, here is at the level of closure of the contraction of ventricle, sorry, and here also at the level of contraction of ventricle, but late, not early. So again, when the ventricle contracted, we mentioned that it's the blood slammed shut the AV valve, and after that, the blood also will go from the higher pressure, I mean the ventricles, out into the, in this case, for example, we talk about the right ventricle, so the blood will pump up into the pulmonary trunk, and on the left side, the blood will be pumped to the aorta. So now the pressure that was higher in ventricles will be shifted to be higher now in the pulmonary trunk and in the aorta. Now the blood will try now to return back to the ventricle. Once the blood tries to return, it will fill the sinuses of similar valves. So filling these cups will close and approximate the cups to each other and close the semilunar valves and prevent the blood from returning back to the ventricles. So we have two sounds, lob, dob, lob, dob. So the lob is produced by closure of AV valve, I mean tricuspid valve and bicuspid valve, at the start of ventricular systole. But the dob is produced by also closure, but what? Closure the semilunar valves, I mean the aortic valve and pulmonary valve, at not the beginning of the ventricular systole, at the end of ventricular systole. Again, just to make it like clear, let me show you in this. I would use this figure again. No, I will use this. So, okay, here's the when the blood moved from the atrium to the ventricle. Now the pressure in the ventricle increased, so the ventricle will contract. Once it contracts, it will push the blood against, the blood will slam shut the AV valve, the cusps of AV valve, approximating or bring them close to each other and close the AV valve. This is closed. Now, once the blood reached the pulmonary, for example, trunk, the pressure increased in the pulmonary trunk, then directly and decreased, of course, in the ventricle. So the blood will try to return back to the ventricle, but when the blood try to return back to the ventricle, it automatically will fill the pulmonary or aortic valve if you talk about the right or left ventricle. So however, the idea that the blood will fill these cups, sinuses I would say, and by this filling will close the valve. This is number one, and create another sound which is dop. And regarding, guys, the cardiac conduction system, there is a specialized conduction system in the heart that really regulates the beating of the heart and regulates its function to make sure that all chambers are working properly and in appropriate rhythm. So let us dig deep a little bit in this conduction system. This conduction system has a couple of structures. The first one is the SA node, and also you have atrioventricular node. which is known as AV node. SA node, which is an abbreviation to sinoatrial node. The sinoatrial node is the most important structure in this system. This is the pacemaker. يعني هي صانع الخطو. صانع الخطو يعني هي صاحبة الشرارة الكهربائية الأولى اللي بتنظم البيتنج للهارت. على although الاي فالف كمان بتعطي على فكره signals، لكن the signals from SA node I think from about 60 to 100 per minute، يعني بتعطي 60 ل 100 signal per minute اللي هو نفسه it's similar to our heart rate. Please check with the physiology guys. So AV node, I think it gives from 40 to 60 beats per minute. So you will not notice and they will have no effect because they will be embedded and covered by the faster impulses of SA node. So the SA node is the pacemaker of the heart, and this is important. Okay, where's the location of this specialized node? You know, it's located at the superior end of crista terminalis. This is a crista terminalis, so it's a superior end at the junction of the right atrium with the superior vena cava. At this junction, located the sinoatrial node, the pacemaker that generates impulses. So after us, you know, the impulses from SA node will distribute to both atria. So the atria will contract. Now, the AV node or the atrioventricular node that's located at the junction of atria and ventricles also generate impulse acid, but will be embedded by SA node. However, it's related close anatomically. It's close to the opening of coronary sinus. Now, if you look to the this figure, you will see that there is a bundle which is known as bundle of Hess. This is the scientist who discovered this bundle. The bundle that's located in the interventricular septum will be divided first to right and left bundles. So, of course, the right to the right side of the heart and left to the left ventricle, left side of the heart. Now, so this, as I mentioned, the bundle of is divided into right and left and continues. I think you remember before a couple of slides we mentioned the moderator. We talked about a specialized type of trabecular muscle, which is the moderator band. Look at the right bundle. It passes through this bridge, through the moderator band until it reaches to the ventricle and terminates with Purkinje fibers in the walls of the ventricles, as you see here, guys. So let me summarize it. So the conduction system that we have start with the SA node, and that creates or begins the electrical impulses that spreads, of course, to the two atria, and it triggers their contraction. So atria will contract. Then it reaches the AV node. After that, the impulses will travel through the AV, as I mentioned, AV bundle that divided into right bundle and left bundle and terminates in the wall of ventricles as Purkinje reach the Purkinje fibers in the wall of the ventricle, and they trigger the contraction of the ventricles. So the conduction system in the heart stabilized or not stabilized, enhance the simultaneous contraction of the atria and the ventricles.